Our next speaker is Rade Injac. Rade was, this is his introduction. Rade was born with curiosity and love for natural sciences, which was resulting in getting a basic education connected to pharmaceutical science. Today, after 20 years of experiences in public health, academia, and industry, he believes in the power of nature as well as the power of the international scientific community, especially in difficult times as we are facing now. However, that power, as everything else in the human domain, has limitations. Therefore, with global experience and current work and new product launches for over 120 countries in his responsibility, he will give us personal views on different levels of funding for development, production, and use of the COVID vaccine. All right, take it away, Rade.
Thanks, Jamie. I got very anxious listening to the others. I feel like being in the sandwich in the middle because I work also in the pharmaceutical industry. However, and I'm also in academia, and I work also in the public health in the past. But I have to disclaim that whatever I'm going to say, it's based on the facts from a scientific point of view, and also from many publications which have been published in previous years. I'm giving very much my more, not brain, but more emotional and gut feeling in all of this. So it will be very personal opinion. And listening what the others are saying, it's maybe good to start that when I was teaching in university on the regular base, on the daily base, every new generation, when they were coming, I was starting my first lessons with welcome to the class. And they were being the 4th grade at the university. And I'm telling them, you are part now on the biggest global prostitution, being part of the pharmacy. So every year I was facing the, the call from the dean office to being asked again and again why I'm saying that. And but my speech was followed also within in front of students, that beside the fact that the pharmacy is a big prostitution globally because it has to please many payers on different levels, and has to lobby many things, and has to work on many marketing options to survive in the global environment. On the other side, some things can be done for pleasure as well as it is in the prostitution, but still it's very selective on the way how the donations are done and other things. However, I have to remind you, and I was opening also that in discussion with the students, that today the expand of our regular life is much longer than it was many years ago. That there are many big experiments and many big R&D innovations found in past centuries. And at the end of the day, you know, all of us, we are easy to criticize the things, but when it comes to our own health and health the people around us, we are asking, is anything new? Is there anything possible? We are not asking how much it costs, and we are not asking what is behind the R&D for that medication. We are just looking to get well. So today my presentation will be focusing several points you can see on this one slide, and I really don't want I didn't want to prepare more than that. I want people to listen and to think. So I want to shake your brain today, and I would like to hear some questions and feedbacks on that. We are 7.8 billion people at the moment on the world, and current estimation is that Corona is killing around 2.8%. I have my personal opinion about that. I think that this 2.8 cannot be directly connected to Corona. However, even if he goes with that number, because most of the people dying from infection of Corona have complications due to the other diseases, which probably at the end would also affect their lives in the following months and years. However, if you look in that number annually, in past years, 56 million people are dying. And if today we will let it go, Corona, to go big time without masks and anything, 218 people maximum, 218 million people maximum will die if we talk about this 2.8% of population out of 7.8 billion. So if Charles Darwin would be sitting today with us around this table, he would say it's a natural selection and nothing else. So viruses are part of our life as all other microbes, and this is normal cycle. And at the end of the day, we are talking about 9 billion people in 20, 30 years from now. I strongly believe it's not going to happen, because the way how we are treating the planet, the nature is going to hit back in many different ways, including microbes, viruses, and also natural disasters. If you look in the R&D, the funding has a different foundations. So funding can go from the government, can go from the private sector, can come from the private individuals which have interest to invest in a certain point of time. And I want to remind you that many years ago, 30 years ago, nobody really cares about HIV. HIV was a disease of a homosexual person. At that time, no one actually announced pandemic. No one put any restrictions in society till the moment when kids have been born with HIV, and also half of the population who get HIV infected became female and kids at the end of the day, which is also the situation today. And that funding, which was at that time in R&D, was purely coming from the private funding. It was coming from the LGBT community. It was not coming from government, and it was not coming. Basically, the most of that was not coming from any pharmaceutical companies. If you look now, what was said before, R&D funds which happen, and also small companies and startups coming together. I didn't want to talk about that, but I think it's good to say. Me, ethically, as a pharmacist and science, I'm grateful that the big giant is helping the small startup in the situation like that, because the startup company doesn't have any experience, and they have much more tendency and hungriness for success in a way to make something out of something small, and to go. And there are evidences in the past where startup companies were faking some results. I'm not talking only on the pharmaceutical science, I'm talking about the other things. So to have someone who has much more on stake to lose if goes in a partnership with you is also giving us as a society a certain level of feeling more safe. I have a yellow book here, so I'm the one who is really believing in vaccine. I think that the discovery of vaccine is one of the biggest discoveries in pharmaceutical science besides the antibiotics. However, there are also limitations. I personally had Corona in March. I had 3 days very bad situation, even though that I'm super healthy and I survived. I have still antibodies. And in general, I'm asking myself, why vaccination for 2.8% population being affected? So this is still a big mystery for me. And if everybody is saying that funding is going to one direction, that the global, and if you're listening politicians, if you're listening to the World Health Organization, they're saying all scientists are getting together and putting all the efforts to make vaccine. My simple reaction on that, it's a bullshit. Why? Because we have 65 trials ongoing globally, 11 trials going on the phase 3. If scientists would be stepping together around this topic, they will developing together 1, 2, maybe 3 options to see which one is the best. But we have clearly competition on the global level, as usual in the crisis, not only in this case, but in many other situations, where actually the minorities are trying to push certain things forward, making fear in the society, and that way also trying to make something beneficial at the end. So for me, it's constant question I put here on the presentation on red: why? Everyone has to start from her or his point of view. Why is this needed? If you go into the production and distribution, just to remind you, most of vaccines that most of us got during our lifetime are kept under refrigerated conditions. So between 2 and 8 centigrades, which is around 35 to 45 Fahrenheit. And there are some indications that the current corona vaccine, probably due to the different technologies which have been used, should be stored under minus 80 centigrade, which is minus 112 Fahrenheit. If that is the case, that would be really difficult with regards to logistics and also the storage, and also to keep stable and safe all the time from the moment of production till the moment distribution to the clinical centers where it will be given to the patients or volunteers which would like to be protected. So currently there is 1.6 billion capacity globally with regards to the seasonal flu. And this 1.6 billion was in past 20 years pushed by World Health Organization to be done on that way. However, this year, in this season, only 200 million vaccines will be produced and given to the community for the use, because in the past years, on average, between 150, 160 million in 2 seasons on the south and north have been administered. So people are not really keen to take this kind of vaccine. I'm asking myself, if corona is so damaging the certain level of society, and if we have a maximum number, according to a percentage, 218 million people who are potentially can be affected and with a very bad outcome. Why these people are not taking at least the flu vaccine? So it's contradictory what is happening in our society. And at the end of the day, I want to remind you also one thing. If you go to look into the data of most of vaccines, the vaccines which have been developed in the previous century for many other diseases are showing more than 90%, in some cases 95, 80% of efficacy. Flu vaccine seasonal, which we are using, is constantly monitored every winter, and actually is giving protection 6 to 9 months, not even longer, and it goes from 10 to 60%. The highest efficiency was 60%, never higher. In 2003 or 4, it was only 10% because they didn't really hit the right type of virus which was out there. If you come to the pricing, so everything what I said, R&D, production, and so on, pricing currently in the US, you can buy the flu vaccine for $15, and HPV vaccine can go up to $250 for condyloma virus. So this is the range of the prices in the USA. In general, globally, the price go between $3 to $50 in the rest of the world in the globe. The production costs can go from $2 to $20 per shot. So probably most of the people are asking what is adding on the top. One of the things which is adding a lot of cost on the top is connected to this logistic and distribution, and also the way how vaccines have to be stored, because you have to carry on all the time the same temperature. So just think from the factory to the track, from the track to the airplane, from the airplane to the other track, from the other track to the warehouse. So all the time there is no spot where you can drop the temperature if it's storage condition to 8 or even minus 80. So this is also creating a lot of costs on the way, and of course at the end there is a profit. And the big question is, if we have all these R&D funds, if we have all of this money coming in from different people, different government, taxpayers in the early stage, why at the end even vaccine has a price, if vaccine is something which is good for society? So from that point of view, we are asking ourselves, who is going to pay the corona vaccine? So question is, do we really need, if it's going to be must to take? Then some of the governments are discussing, if I as person is going to refuse vaccine, that in case that I'm getting coronavirus and I need hospitalization, that in that case I have to cover the cost in total. So even some governments are going into that directions. Our insurances are going to pay the vaccine, our governments are going to pay the vaccine, or it will be out of the pocket. At the end of the day, it's also connected to limited funding. So if you just think now, many people this year working for airlines companies, touristic organizations, small services, they lost their jobs. Who is paying for insurance and who is paying the taxes? People who are getting salary every month. So the government is helping them in the period of 6 to 12 months to have health insurance, to have a certain percentage of the salary. But what we are facing now, and some of the countries already publicly came out with that medications that have been delivered in the last 6 months to the certain governments haven't been paid by the government because government doesn't have the money. And this is going to come also next year. So less people are going to work, less insurance companies are going to get money on the health insurance, less taxes are going to be collected from the salary. And at the end of the day, it will be very limited funding also from the government to support medications and vaccinations on the global level. And the last point, which I would like to mention here, is connected to pandemic effects. So at the end of the day, next year, they said that they're going to deliver a certain amount of vaccines. And I hope that no one is going to press the button to go with the pediatric use, because, every single little thing which is put in our bloodstream make reaction. Our body is making antibodies to everything which is unknown to the body. So if you put certain genetically modified part of virus, part of the toxin or whatever connected to the virus in human body, of course it will be reaction. The question is if that reaction is with a certain level of efficacy, and if that reaction is giving a safety profile in comparison to what actually is the benefit of vaccination. Today, nobody can completely answer that question, and it's normal. Every medication which is launched out in 10 years period is monitored very closely. Many medications have been removed from the market due to the different reasons, adverse events. So it's a life cycle of medication. So I'm not saying that it doesn't have to be used, but it has to be very clever, on the clever way, and very carefully done. What is going to happen? We will have limitation on capacity. We will have limitation on the number of people that will be taking the medication. or vaccine, even though I did a survey a few days ago with the people which are around me. So I collected around 3,000 feedback. So 50% said yes, immediately we'll take vaccine, 50% said no. And I was concluding 50% of the people will take risk to take vaccine, and 50% of the people will take risk to get infected. And my friends, they hated me because they said, you put a risk on both sides. Yes, I'm putting the risk on both sides because I don't know what is right. However, with all this situation that we are having now, that we are facing at the moment, our immune system with the mask are going to go down. Obesity is going to go up because we are not moving properly. Depression is going to go up because of the whole situation of isolation. So it's normal that people are going to start using more antidepressants and sedatives. Violence in the family is going to get more, and in general in society, divorce level is going to get more. Abuse of drugs and alcohol is going to get to the higher level than it was before. Economy is going to crash at a certain point of time, and suicidal rate is normally getting 5% higher after every crisis globally. So having said that, I'm still asking myself why and how we are going to deal with that in the next year. There are a lot of promises, but I still think that there are many questions to be asked and answers to be shared.